who is the director at the Centre for Postgraduate Pharmacy Education, CPPE. So CPPE is a provider of educational solutions for the NHS pharmacy workforce across England to maximise its contribution to improving patient care. So after years of promoting sustainability internally, CPPE is now seeking to embed this approach across its work programme. In this session, Matthew will invite us to reflect on our own preferences and drivers, on barriers to change and the need to reflect on the choices that we make on our own and others' behalves. So Matthew, over to you.
Thank you very much, Nuala, and hopefully you can all see my screen. I was listening to other people introduce themselves this morning, and I was reflecting on the fact that I live in Belper, which is in the Amber Valley World Heritage Site, and we're a World Heritage Site because this is the heart of the Industrial Revolution. I was born in the Potteries, which is basically a wasteland of kilns, again, from the days of industrial destruction of a local environment, I guess. I went to university in Bradford, we're famous for its dark satanic mills, and I work at the University of Manchester, which is that wonderful hive of industry in the north of England. So how wonderful that I'm here to talk about sustainability with that incredible heritage behind me. As Nuala says, the Centre for Pharmacy Postgraduate Education is here for the NHS pharmacy workforce across England. And I think it's interesting to think that for as long as I've been at the organisation, we have been working in this area, perhaps largely hidden. What I'm going to go through in the next 20 minutes is basically the history of where we are, what we've done. I'm going to look at the engagement that we have put in place in the organisation and the organisational change that is consequential to that. I'm then going to look at the challenges that we have faced and what our commitment is for the future. So, where are we in terms of the history? When I first started working in the head office in Manchester, I think it's fair to say that what I tried to do was to enable people to make positive choices. So the tutor team at that point, around 70 local tutors across England, would travel around the country in the evenings and at weekends to run continuing education workshops. And I tried to encourage people through policy and process to make positive choices. So invited people to use public transport rather than private cars. We thought as well about the venues that we chose to use. If we're running a workshop for 32 people and they're coming again in their personal cars, that's 32 journeys. If we could move the venues to hubs, which were near to train stations, which were on bus routes, then we can encourage people to make choices about travelling by public transport. Interestingly or not, what we've learned from experience is that pharmacists like to use their own cars. They're very proud of them, whereas our pharmacy technician colleagues were often much more willing to explore public transport. I'm not going to start to suggest what reasons may be behind that. Another big thing that we could do at an organisational level was to think about the purchasing choices that we made. So again, back in 2002, our learning was either done face-to-face, and you got little workbooks when you came to the sessions, or it was done through printed and posted distance learning programmes. So we looked at what we could do to put change in place there. We moved across to forestry standard certified paper sources. It's more than just the tree, it's the whole way around the management of the forest, the treatment of local communities, the way that it is treated and the way that it is distributed. So it's an absolutely critical thing for us to do that. And we started to use vegetable-based ink. So again, most of the inks that you probably see being used are petroleum-based. That isn't just a question of the fact that they're using oil in their manufacture, but it's the fact that if you then want to clean the printing presses, you need to use different solvents, often more harmful to the environment than you do if you use a vegetable-based ink. So those choices that we made at the organisation with our printing were positive choices. Like many organisations, we were then encouraged to print less. And what we found is that that actually shifts where the printing happens, and people are then more likely to print things for themselves at home. I doubt everyone at home is making sure that they're using FSC paper or vegetable-based inks. And I know that the ink cartridges that people use at home have a much, much higher plastic to ink ratio than anything that you see if we do the printing on your behalf. If we move into slightly more recent times, since 2012, so for the last 10 years, CPPE has engaged in the National Union of Students Green Impact Scheme. This covers a range of different areas that looks at what you do organisationally to commit to sustainable things. It covers everything like turning your lights off, the choices that you make in terms of, for example, our water cooler. We've moved across to one that's plumbed in rather than that uses plastic bottles and refills them. All the way through, those questions are there. And so that was something that we did within the head office team to make our commitment clear and ongoing. So that's history. I was a little bit surprised then to discover that all of this work wasn't necessarily visible across the organisation. And one of my incredible team challenged me and said, "Don't you think it's about time CPPE did something?" I might be paraphrasing that slightly. But it really brought it home to me that the work that we were doing as an organisation wasn't visible. It wasn't visible internally, and quite possibly wasn't visible externally either. So we shifted our approach to try to make much better engagement with the wider team and to try to make the issues and the solutions that were put in place real for everybody. And I wanted to make sure that this was a two-way process. As Angela was saying, she wants ideas, not just questions. I wanted ideas from my team on what we could do differently, as well as trying to get an acceptance of a need to go further. What we now have is what we call the CPPE Greener team. We're quite deliberately calling it greener because it's better and we're trying to get better, but we all recognise that there is still a big distance for everyone to be going. But that team owns the concept rather than it being something that's owned just by me or just within the head office team. And what I have seen happen is that by having this collective in place, and I think it's worth saying that the two volunteers we have this morning are part of that collective at CPPE, they drive the change across the organisation. And that energy, the passion that they're bringing to it is really helping to engage more people, to convert the way that people think, and to bring more people on board with the work that we're doing across the organisation. And then once a year, I bring together my whole team, about 200 people now, and Nuala puts up a question to everyone and says, okay, what are you doing now? What's the change that you have made? So that we can look over time and see what impact and what change we are having at an organisational level through the actions of individuals. We're then making sure that we're more visible about it. So we send out a monthly update to the whole team to tell them what we're doing. The very first slide that I put up had some little pictures in there of things that we've done, like the UK litter picking. We've got people that are going out there, they share vegetable menus with each other. We're looking at how we reuse things as well as how we reduce stuff. And then because we recognise that we've got around 65,000 learners across England who'd come to us, we're sharing that work with them in the hope that we can influence the choices that they are making. That doesn't mean that we're not making changes at an organisational level as well as at individual level. And these are three of the big changes that we have implemented this year. The first one is moving across to vegetarian food. What does this mean? Well, organisationally, we still run workshops. We run the National Primary Care Pharmacy Education Pathway. And in a typical year, we probably spend around £2 million on venues. That's a lot of budget to shift into positive choices. So by only providing vegetarian food instead of meat-based food, we know that we're looking at lower energy, more sustainable options, as well as potentially options which are healthier for the group as well. We've moved across to using Fairphones. So about 170 members of my team are based all over England, working in education supervision, one-to-ones with people who are newly qualified pharmacists. Any students here who don't know about that, make sure you sign up. And in running workshops still. And we give all of them a phone. And up to now, that's been an iPhone, which you'll know is one of the hardest phones to repair. So we've moved across to the Fairphone, which is the only phone that has been designed to be sustainable. It's repairable. it uses conflict-free gold. Again, it's the only one on the market that does that. So we're making this active choice to give somebody a great product, but one which works from a sustainability perspective. And then, like many organizations, we're running a lot more events online. And we have learned that that meant that people were having to print things off at home in order to be able to run a session. So we've provided everybody with a really quite small and compact, very lightweight second screen, so that we can move away from people printing at home and all of the ink cartridges that we know that that must result in. So those are just 3 of the changes that we've made this year. What have I learned with doing this? Well, I've learned that embedding things can become invisible. And I think that's a challenge for all of us, that when we make a change and we put it into the absolute fabric of the way that we're trying to work as an organization, then it loses its visibility and people don't always recognize or realize what it is that we have done. I said that we've moved across to vegetarian food because it's a lower energy source. And it isn't necessarily a lower energy source if the venue feels that there's a need to give you something that looks or has the texture of meat. So fake chickens, other fake meat sources, which require a lot more energy in their production than, let's say, cooking sweet potatoes or butternut squash or a carrot. And they don't necessarily end up with people preferring them either. I've learned that people like the idea of change much more than they like the reality. So whilst I think it's probably fair to say that across my organization, I have 200 people who recognize that climate change is real and recognize that something needs to be done about it, when there's something that needs to be done, impacts on them as an individual, that level of engagement can dip just a little bit, or with some people quite a lot. I've learned that you need to bring people along with you, not just do things to them. And I think, again, that is one of the hardest things to get out there. With moving across to vegetarian food, I've been told that I am challenging the values that people have and that I'm potentially damaging local farming communities. Every choice that we make has consequences, and we need to try to think what those could be and whether we're comfortable with the impact of the choices that we're making. And then finally, although I think it's fair to say today that everybody agrees with this and that I'm preaching to the converted, that isn't necessarily the case. And I still have members of my team who come forward to me and say that I'm using bad science or there's science that suggests other things, and that there is doubt as to what the nature of truth may be at any point in time relating to sustainability. So what is it now that is the commitment at CPPE for the future? Well, one of the big ones is equipment purchases that last. You probably all know that an average mobile phone might be expected to last for 2 years, maybe 3 years if you're really going to push the boat out, maybe a year if you've got children. The Fairphone comes with a 5-year guarantee. And I've put down on the bottom right here this image of the jump. I don't know if people are aware of this. It's 6 commitments that people can make that collectively could result in us managing that 1.5 degree rise. And one of those is saying, if you're going to buy something, make sure it lasts for at least 7 years. So when I look at the computers and the screens and the devices that I'm buying for people, I'm trying to make choices that mean that those devices will last for 7 years. And for anything related to technology, that's a lifetime. I'm looking at whether we can move across to printing on demand, because although I'm using FSC paper where we do print and we're using vegetable-based inks, if I print off 1,000 copies of something and only use 500, that's 500 items that are going to go straight to recycling, not waste, straight to recycling. If I can go to print on demand, then I can still maintain the paper quality, I can still maintain the ink quality, but I can cut out that waste completely. And I think that the 3 things that I'm absolutely passionate myself about getting out there is that we make sustainability routine without letting it become boring, without people saying, oh, you're harping on about that again, as somebody said just earlier this morning. I want to make sure that we retain the passion without preaching. And again, this is one of those difficult things to attain. We've moved across to vegetarian food because it's a sustainable choice, because it's an energy-based choice, not because I have a problem with people eating meat. And trying to make sure that we get that across, this is a passion for sustainability rather than preaching or trying to change people's beliefs and values, is critical. And finally, I recognise that we have to continue to seek out that evidence to support engagement. Much as I would love to say that it's axiomatic, that people know that this is true, that is not the case. And I need to make sure that when I make decisions, I have the evidence to explain that decision. So that's it from me. I've included in here the link for our Gateway page, which is cpp.ac.uk/gateway/ENVSUS. And what we've tried to do there is pull together a series of resources that help to explain sustainability for the pharmacy workforce and for others as well. Please explore it, have a look, and get in touch with us if you have any questions or any ideas about how we can do better. Thank you.
Great, thank you very much, Matthew. So really interesting to hear, sort of following on from Angela and Melissa's presentations where they talked about change from the bottom up. It's really interesting to see the challenges faced when trying to make organizational change. Of course, I am very familiar with all of this story and I'm part of it, which is great, but it's really good that ideas from staff are implemented into policy, because I think, as we've seen this morning, you know, that's really the way forward. But really interesting that of the challenges, I guess, that we face in enabling people to make those positive choices. So we've got a few questions for you, Matthew, in the Q&A box. Let me just have a look. So from Shmuel asking, what, according to you, are the opportunities created during the COVID-19 pandemic for more effective embedding sustainability, including sustainable and healthy lifestyle in education system?
Okay, so I think the single biggest one was that it meant that everybody suddenly had to accept learning remotely rather than coming to something face-to-face. And one of the things that we worked hard to do at CPP with that was to retain that level of engagement. So we run workshops online where we try to keep that engagement in, rather than, and I'm not being cheeky about today, rather than just having a webinar for 200 people where you can ask questions. So we're trying to make sure that we've got that sense of community in there. What we have learned, though, is that that isn't just enough. If you want to do clinical assessment skills, if you want to learn how to touch another body, which we do increasingly have to do in pharmacy, you have to be able to practice that. So we are bringing face-to-face back, but we're making sure that for everything we do face-to-face, we ask ourselves if we're doing it because it's easiest or because we need to. So the single biggest thing that COVID did was force people to learn how to engage in sessions such as this one, where we work remotely from home.
Okay, great, thank you. And I can definitely second that, because I remember the first learning set that we did online. Terrifying. So,
but
really,
now familiar, hey, Nuala?
Yeah, exactly. It's second nature now, and great that we're able to do this and have all these people joining us from all around the globe via Zoom, which is fantastic. Okay, that's great. Thank you very much, Matthew. And I would encourage you all to go and have a look at the Environmental Sustainability Learning Gateway. You'll find links to all sorts of things that we've talked about this morning, including the e-learning for health, sustainable healthcare modules. There's also a video from Richard Hickson, who somebody mentioned earlier. So a gateway to all sorts of learning available to everybody there. Thank you, Matthew.